Level 1. The failing grade. You're 23. You sit in a campus library at 11 p.m., staring at your biochemistry textbook. The words blur. You've read the same paragraph 4 times. Tomorrow is the exam. You know you're going to fail. This is your second attempt at med school. First time you dropped out after 6 months. Your parents remortgaged their house to pay for this. Your father calls every Sunday. How are the studies going? You lie every time. You scroll through your phone. An ad pops up. Degree verification problems? We can help. You close it. 10 minutes later, you open it again. The website looks legitimate, professional. Testimonials from people who needed a second chance. You tell yourself you're just looking. Just curious. You're not actually going to do anything. The exam is in 9 hours. Your hands are shaking. You click, Contact us. Level 2. The first contact. The reply comes in 40 minutes. Professional tone. No pressure. We understand the challenges of modern education. Many qualified professionals struggle with standardized testing while possessing real-world skills. They're not selling you a fake degree, not directly. They're offering accelerated credential programs and international equivalency services. The language is careful, legal sounding. You fail the exam the next day. 58%. You needed 65. That night you reply to the email. You tell yourself you're exploring options, backup plans. You're not committed to anything. They respond with a questionnaire. What field? What level? What country? They ask about your existing coursework. We can often integrate legitimate credits into accelerated programs. That phrase sticks with you. Legitimate credits. You have some of those. The price quote arrives 3 days later. $12,000 for a bachelor's degree with international verification. $18,000 for a master's with transcripts. $25,000 for MD equivalency with residency documentation. You close your laptop. This is insane. This is criminal. You open it again at 3 a.m. You're thinking about your father's mortgage, about the Sunday phone calls, about the fact that you're actually good with patients during your clinical rotations. The textbook knowledge just won't stick. You write back. Tell me more about the MD equivalency. Level 3. The rationalization. They don't call it a fake degree. They call it credential optimization. You're on a video call with a man named Marcus. Suit and tie. Neutral office background. Could be anywhere. He explains the system. There are countries with less stringent documentation requirements. Universities that have closed, but whose records are difficult to verify. Accreditation bodies in certain jurisdictions that are more flexible. We're not creating fiction, Marcus says. We're finding pathways that exist within the system. He shows you samples, degrees that have passed employer verification, transcripts that cleared background checks. He pulls up a LinkedIn profile. This is a client, VP at a pharmaceutical company. Started with our services 8 years ago. You ask the question you're supposed to ask. Is this legal? Marcus smiles. That's a complex question. The documents are real in the sense that they come from real institutions. The verification systems are real. Whether the education itself occurred is a matter of interpretation. You should hang up. You know this. Instead, you ask about payment plans. Level 4. The transaction. You pay in installments, $3,000 down. The rest over 6 months. They accept cryptocurrency for privacy. You use your credit card. Somehow, that feels less criminal. The process takes 4 weeks. You fill out forms. Real information mixed with fabricated details. They ask for your actual coursework. We'll integrate what we can, they say. That makes it feel less like fraud, more like creative documentation. You receive PDFs first, a bachelor's degree from a university in Pakistan, dated 7 years ago, a medical degree from a school in Grenada that closed in 2019, transcripts with grades in courses you never took, rotations at hospitals you've never seen. The physical documents arrive by FedEx, heavy paper, embossed seals. They look real because, in a technical sense, they are real. The paper is real. The seals are real. The institutions existed. Only the education is fake. You hold the medical degree in your hands. It has your name, Doctor of Medicine. You worked for this, in a way. You did 2 years of actual med school. You passed some exams. You completed rotations. This document just skips the parts you couldn't handle. You tell yourself this is a formality. You have the skills. You're good with patience. The degree is just paper. You frame it. You hang it on your wall. Level 5. The first job. You apply to positions overseas, countries with physician shortages, places that need doctors more than they need perfect paperwork. Your forged credentials list international experience, rotations in 3 countries, research publications you didn't write, but that exist in predatory journals. A clinic in Southeast Asia responds. Rural area, underserved population. They verify your degree through the service Marcus recommended. It clears. Of course it clears. The verification company is part of the ecosystem. You're interviewed by video. The clinic director asks about your experience with tropical diseases. You've read about them. You sound knowledgeable. She doesn't ask detailed questions about your residency. She's desperate for staff. You're hired. You'll start in 6 weeks. The night before your flight, you can't sleep. You're thinking about the Hippocratic Oath. First, do no harm. You haven't taken that oath because you didn't actually graduate. But you know what it says. You board the plane. You tell yourself you'll be careful. You'll only handle basic cases. You'll refer anything complex. You're not going to hurt anyone. That promise lasts 3 weeks. Level 6. The practice. The clinic sees 100 patients a day. The nearest hospital is 4 hours away. You're the only doctor for 30 kilometers. Careful referrals aren't an option. You handle everything. Most of it is straightforward. Infections, diabetes management, prenatal care. You remember enough from your rotations. You look up what you don't know. You're not incompetent. You're just incomplete. A boy comes in with breathing problems. You diagnose pneumonia. You prescribe antibiotics, standard treatment. He gets worse. By the time you realize it's not bacterial but a parasitic infection, it's almost too late. The hospital saves him. Barely. You lie awake thinking about that case. You got lucky. The infection wasn't resistant. The hospital had the right drugs. If one variable had been different, that boy would be dead because of you. You don't quit. You tell yourself you learned something. You're better now. More careful. A woman comes in hemorrhaging after childbirth. You know the protocol. But there's a complication you don't recognize until she's losing consciousness. The nurse, who's been doing this for 20 years, sees what you missed. She takes over. She saves the woman. Afterward, she looks at you with something like pity. She knows you're not a real doctor. She doesn't say it, but she knows. Level 7. The unraveling. You last 14 months. The clinic director starts asking questions about your residency. She wants to call your references. You give her the numbers Marcus provided. They answer. They confirm your employment. They're part of the service. But she's suspicious now. She requests your original documents for recredentialing. You stall. You say they're in storage in another country. You'll get them shipped. Marcus provides new documents, updated versions. But she's already submitted your information to a verification database that's more thorough than the first one. The call comes on a Tuesday. She asks you to come to her office. She has a printout. Your medical school closed in 2019. The listed address for your residency program is a shopping mall. The transcripts show courses that don't exist in the archived curriculum. You could lie. Say you were deceived, too. That you thought the degree was real. Instead, you just sit there. Silent. She asks you to leave. Today. She's not calling the police. She's not reporting you. She just wants you gone. You're lucky, she says. That boy with the parasitic infection. That woman in childbirth. They're lucky. Someone died because of you. And it's only luck that they didn't. You pack your apartment in 4 hours. You're on a flight the next morning. Level 8. The aftermath. Back home, you work retail. 40 hours a week at a pharmacy chain. Not as a pharmacist. You stock shelves. Your parents think you're taking a break, recovering from burnout. They don't know you were fired. They don't know the degree framed on your wall is worthless. You see Marcus's emails sometimes. New offers. Updated services. We've improved our verification process. You delete them. You think about turning yourself in, reporting the service. But that means admitting what you did. Facing consequences. Possibly prison. You think about the boy with the parasitic infection. He's alive. Grown now, probably. Playing soccer, going to school. Not because of you, despite you. You think about applying to med school again. Legitimately this time. Starting over. But you're 31 now. You'd be 40 before you finished. If you even got in. If you could even handle the coursework. You stock shelves. You scan items. You go home. At night, you look at the framed degree on your wall. You should throw it away. You should burn it. Instead, you leave it up. A reminder. Of what you wanted. Of what you pretended to be. Of how lucky you got that nobody died. Level 9. The shadow. Years pass. You move up to assistant manager. You're good at your job. No lives depend on your work, which makes it easier. Sometimes patients come to the pharmacy counter with questions. Medical questions. They see you in your white coat, your name tag, and they assume you know things. Sometimes you do know. Your incomplete medical training left you with real knowledge. Incomplete, but real. You answer their questions. Carefully. You never diagnose. You never prescribe. You just inform. Point them toward resources. Suggest they talk to the pharmacist. The pharmacist notices. She starts asking you to help with consultations. You have good instincts, she says. You don't tell her why. You enroll in a nursing program. Evening classes. 2 years. Legitimate this time. Every exam. Every clinical hour. You pass everything. You become a nurse. It's not doctor. It's not what you wanted. But it's real. You work in an urgent care clinic. You're good at triage. You know what's serious and what isn't. The doctors trust you. One of them asks where you trained. You think like a physician, he says. You smile. You don't answer. You still have the framed degree in a box somewhere. You can't bring yourself to destroy it. Evidence. Guilt. Memory. You'll never be a doctor. Not really. But you help people. Within your scope. Within your training. You do no harm. Most days, that's enough. Some days you think about that boy. The parasitic infection. How close you came to killing him through ignorance, disguised as authority. Those days are harder. Somewhere, a 24-year-old sits in a library at midnight. She just failed her nursing boards. Second attempt. She's scrolling her phone, exhausted. An ad pops up. Credential problems? We can help. She stares at it. Her finger hovers over the link. She has no idea what's coming.